Now, some foreign women have described harrowing experiences when giving birth at public health facilities. This ranges from being compelled to pay hospitalisation fees upfront to what some health experts have described as obstetric abuse. To help us unpack these and anti-foreigner sentiment in South Africa's health facilities is health reporter Lilita Gcwabe. Lilita, good afternoon and thank you so much for joining us.
Good afternoon. Thank you so much for having me.
Lilita, I mean, we've seen, especially since that video of Dr. Poppy Ramathuba came out, a lot of these other stories coming out of what one can say anti-foreigner sentiments at public health facilities. How rife is this situation?
I would say it is very rife because women are experiencing this on a daily basis. In the story that I did report on, women like Yolanda Damson are experiencing discrimination, delay of healthcare services and birthing support services. They are experiencing a denial of these services as well as verbal abuse in the public health system. And this is due to the Afrophobic attitudes that are experienced and shared in the public health system.
But is this something that is unique to women that are foreigners, or is it also happens to South African women also?
It does happen to South African women as well, and this is because of the strained public health system that we live amongst. And the minister did mention as well at Kanafong Hospital on Thursday that the health system is strained and is experiencing challenges, a wide variety of challenges from the understaff, from the mismanagement and maladministration of finances, and many other things. So because of that strained public health system, pregnant women and women in South Africa who require antenatal and birth supporting services are victims rather of this, of the challenges that the public health system experiences.
But is it something that the South African government is able to deal with? And looking at the fact that, one, as you've just mentioned, it's a question of access to healthcare. It's a question of facilities being overcrowded at this point. And that's where the argument would come in from South Africa and say, well, maybe that's why we're overcrowded, because there are people who are not supposed to be in the country, who are not supposed to have access to these particular facilities.
No, because the overcrowding exists without the pressure that we experiencing due to African women of foreign origin. There are existing challenges from the staffing issues, as I mentioned, as well as the mismanagement of funds that exists prior to the pressure that is experienced by the public health system because of African women from foreign origin.
I mean, looking at the story that you're reporting of Damson, what are some of the challenges that are being faced? I mean, I understand the challenges would even go as far as health workers per se asking for some sort of finance to assist them to get health care.
There currently is no consistent and reliable amount that is stipulated within the policy of the public health system that states how much foreign women, undocumented women should be paying in order to access these services. So this leaves them to be vulnerable to being exploited and financially abused, because hospitals that they go to require different amounts of money, where women will experience different thousands, where they are asked to pay from 5,000 to 2,000, differing on the hospital and as well as the healthcare workers that they are dealing with on that specific day. And because of that, they enter these public hospitals and pay these amounts of money, but are still then exposed to, like I said before, being verbally abused and being denied healthcare and birthing support services as well.
Now, these amounts that you're talking about, and I mean, as you said, we're still not too sure exactly, are these official amounts, or do some of them come in forms of bribery to get ahead on the queue to get that assistance?
I cannot confirm whether or not these amounts come in the form of bribery, but I can say that African women of foreign origin are expected to pay a certain amount of money to access these services. And because there isn't any stipulated and regulated amount within the public health system, many of these women go to different facilities and are told to pay 5,000 and then go to a different facility and experience a situation where they're told to pay maybe 2,000 because maybe healthcare workers are experiencing and are maybe taking advantage of the absence of a regulated amount of money in order to understand how much they should be paying.
I mean, Lilita, there's been many a report really on obstetric violence, some documented and some otherwise. How bad is this and what needs to happen? Because one can even argue that this falls right within the ambit of gender-based violence.
The observations made by an organization called Embrace, which focuses and deals with obstetric violence, has reported that this instance happens a lot and women are exposed to this treatment on a daily basis. And obstetric violence, yes, does form a part of gender-based violence. It is something that is experienced by pregnant women and women who are in need of antenatal services and birthing support services. And as you mentioned and as we discussed earlier, that South African women are also dealing with this because they are also victims of this strained and pressured public health system that we are dealing with on a daily basis.
But does that also talk to the fact that maybe those people that are supposed to assist them, those that are supposed to help them in that moment, are not properly trained to deal with such? Or does it still speak again to the number of even the lack of healthcare practitioners that are qualified to assist?
So as we saw in the video of the MEC of Limpopo speaking and chastising the patient of Zimbabwean origin, we saw that there were healthcare workers that were watching. We saw that there were doctors who were watching and who were there and not doing anything. And those are people who are supposed to be standing in the way of such treatment towards a patient. So we cannot deny that healthcare workers are also members of their communities. They are also people outside of their professions. So these opinions and these beliefs that maybe they have do intersect with the way that they treat patients. So next to it being a problem of a lack of training and a lack of programs that are able to educate them on these issues, I think it is just to be aware that these are people outside of their professions and then trying to approach and address the problem like that. And next to their obligation and their oath of treating a patient regardless of their nationality and their race and their sex, that we need to address them as people as well and as members of their communities in order to ensure that the treatment manifests and expresses itself in their work as healthcare workers and providers.
Is this a situation that is unique to public health facilities? One would say maybe if it's a private health, it's manifest everything else. Are we seeing something like that, some sort of reports that are coming through from private health facilities, or is this purely at public health facilities?
The women that we have spoken to say that they actually would prefer to save up money and collect money and go and see and consult with a doctor within the private healthcare system rather than going to a public one. This is because of the experience that the experiences they have within the public healthcare system. And they say they don't experience the same treatment within private healthcare. They say if they would rather pay the same amount that they are required to pay in the public healthcare system and take that and go and see a private doctor instead because they don't experience the same treatment in that space.
So, I mean, based on your experience having reported on most of these stories and some of these stories, what are the solutions to this? I mean, there's always been a question of does it go as far as porous borders that South Africa has? to minimize the number of people that come and seek assistance from our health facilities, or is it just simply about having the right rules and regulations to govern such?
I think I would start with governing the situation within the public healthcare system. As we mentioned and have discussed, that the public healthcare system is strained. It is experiencing pressure and challenges outside of the additional pressure that comes from outside and external visitors who come and visit the healthcare system and who need the services that come here. So starting with addressing those problems that are experienced within the system, addressing the problems that frustrate the healthcare workers initially from the resources as well as within the management of the actual hospitals that we go to, the facilities and clinics that we go to, and then trying to support them in order to assist them to provide decent healthcare services to outside people as well, including those South Africans who access those systems as well.
And I mean, in terms of just government and its role, do you find that there is political will, if I may, to deal with this sort of issues? Because more often than not, these issues become a little bit more political than they should be. I mean, the emphasis should naturally be on, the patients that need the assistance, the health workers that need the facilities to be able to do the job. But more often than not, it ends up being a little bit more political. Does it also come down to that where there's not enough political will to come up with the right solutions to deal with these matters?
I think similar to most systems in South Africa, most public systems actually in South Africa, they are victims of the political game that we experience and that we see and observe in South African politics. So if there is political will, I think the question is definitely yes. There definitely is political will, and because we have a budget, we have the ability to provide these resources, we have the ability to train healthcare workers and strengthen the services that we do provide to citizens as well as outside visitors to this public healthcare system. And because of that, there is the ability to provide decent health care to everyone who tries to access it. Whether or not that is happening, we are seeing that there are many challenges to making that happen, and that just brings the public healthcare system as a victim to the lack of management and the lack of being able to make sure that these systems are provided to people.
Lilita Gcwabe, thank you so much for coming through to talk to us. When we return